About the introduction to community medicine and why community medicine is very relevant in today's scenario. So today we will discuss in little more depth about the importance of community medicine for India specifically. Community medicine or public health is relevant in all countries, but why it is very relevant in Indian context. That is what we are going to discuss in this small video. Okay. So why community? Yes, public health is a subject which is there almost in every countries, especially in Western countries. It is really well developed. But in Indian scenario, it has a greater relevance. That we will discuss. Already we had a glimpse of that in the early session. Today we will discuss in little bit depth and detail the problems faced by our country and the way forward. Okay. So I am a proud Indian, and we want our country to excel in every field in terms of getting Nobel prizes, in terms of in sports, in terms of human development. Not only not only about a section of society being developed, but instead it is about inclusive development. Whole of India should develop. So I have traveled across India, the length and breadth. Fortunately, I could travel across India. So what I noticed was there is a great amount of disparity even in big cities. In Mumbai we have Dharavi, and also we have the richest people living in one part of the city, and we have Dharavi in another part. In Delhi we have very richer part and also very slum area. If we go 100 kilometers away from Delhi, we see few people living in very difficult and conditions which was prevailing in 1950s, very poor. So I'm not going to have it play blame games here. So we are a country which got independence only since 75-80 years. So we are a country where resources are very scarce, and we as a country had to face a lot of economic hardships. So in all those scenarios, considering all those scenarios, we did great. As Indian, I am proud of what India has achieved over years. As a country, we have a very good constitution, and we have very inclusive constitution, and we have a very good political system. But I'm not going to talk about how the negatives of political system here right now. This is not a place to discuss politics, but as an Indian, I would like my country to go forward from here. So we will talk only about how community medicine, public health can help India move forward facing all those hardships. Okay. So why community medicine in today's scenario is very important? One is India, as I told you, India is a developing nation. Second, we are fighting both communicable and non-communicable diseases. And third, as I told you, inequalities are very high. In urban areas, we have a very good standard of living. When you go beyond the urban areas, people are living in dire straits, or they are living in pathetic, and most of the people are living in high poverty rates. For example, the poverty, multi-dimensional poverty index, India have a rank beyond 131, if I am not wrong. So the sense of being Indian is lacking in most of the people, because they don't have the essential things in their life to think I'm a proud Indian. So that is also there. And also we are divided based on caste, religion, whatnot. So it's very fragmented society to say. So these are the big hurdles before us, and also corruption is there. So a lot of problems we are facing. So how community medicine or a public health and a person of a medical fraternity can help our nation to go forward? That is what we are going to discuss in this video. So as I told you, we are fighting communicable diseases. Okay. So communicable disease, one of the biggest enemy we are fighting today is, as you all know, it is tuberculosis. The challenges of tuberculosis in India are high burden and prevalence. India accounts about 27% of the global TB cases according to WHO 2023. High incidence of multi-drug resistant TB, that is MDR TB. And the problem, delayed diagnosis, and there is also regional disparities, as I said. Delayed diagnosis and treatment, limited access to quality diagnostics in rural area, social stigma is still there to late health and also late health seeking behavior. So these are all known to everyone, but we are yet to find solutions to all these problems. That is a big problem we are facing in terms of community. So India is facing the twin challenges, not only of communicable diseases but also of non-communicable diseases like diabetes, hypertension, stroke. Lot of non-communicable cancer is rising. Old age people are having problems, and they are more on dependent. We are more dependent populations. So these are all problems we are facing right now. How to solve these problems should be solved. If we can solve these problems, only our country can develop. Without solving these issues, how can we say our country is developed? So having a blind eye on these problems will not help, but understanding the problem and solving this issue is very important, so that we can become a developed nation in the future. Tuberculosis, I said, another problem is drug resistance. Increasing case of multi-drug resistance and extreme drug resistant TB due to incomplete treatments, and also long and toxic treatment regimens deter adherence. Very big gaps in the health systems, overburdened public health infrastructure because of most of the government facilities are overloaded because of high population, fragmented private sector participation with variable quality, and the private sectors at one end, majority of the private sectors are not having that kind of social responsibility, and they're exploiting rural population for their own benefits. That is a big challenge also. So there is no sense of social responsibility, there is no patriotism in many of the people around here. So coming to another important challenge we are facing is malaria. Okay, malaria, as you all know, it is also another communicable disease. Challenges of malaria control in India: geographical diversity is there. Endemic, it's both malaria is endemic to both rural and urban areas, especially in tribal and forested regions. Difficult terrain hinders access to healthcare services. Vector resistance, that is another important thing. Resistance of mosquitoes, that is Anopheles species, to insecticides, reduces the effectiveness of vector control programs. And drug resistance, increased resistance of Plasmodium falciparum to anti-malarial drugs complicates the treatment. So these are all problems we are facing right now. So these geographical diversity, vector resistance, and drug resistance, these are all problems we are facing in terms of malaria. Okay, and other important challenges include inadequate surveillance, climate and environmental factors, socio-economic factors, health system challenges like under-reporting of malaria cases, weak diagnostic infrastructure, monsoon patterns and stagnant water, urbanization, socio-economic factors like high burden in poor marginalized communities. Health system challenges include shortage of trained health workers in rural areas, fragmented coordination between central and state ones. So these are all problems we are facing as a nation. So to understand these problems, to solve these problems is very inevitable for a developing nation. So another important challenge is social fragmentation. Society is fragmented among different fault lines. One of the fault lines, as is caste and regional disparities, corruption is there. So these are all problems we are facing. We have to solve this. So those who are watching this video should understand we should have their social responsibility in ourselves. Then only we can solve these issues. If we are fighting around caste, color, creed, gender, or what not, if we are going to do that, we are not going to be in a better position at any point in time. So we should understand the problem and try to solve this one by one. And coming to the medical education part, the problems in the medical education are regional disparities, or lack of infrastructure is there. We don't have adequate faculties and trained. Even exploitation by medical colleges is also there, where they don't follow the NMC norms and they don't keep adequate faculties for the medical students, and medical students don't get the right kind of medical education. They are being cheated. So these are all there in our country. So these are the things which is there, and when we are going to solve this, how we are going to solve this is a big question we have to ask to ourselves. First thing, we have to change ourselves, have a good motivation for yourself that yes, I want a change for our country, I will be the change. Then only we can go forward as a nation. So these are the challenges faced. And another important problem is lack of scientific temper. In the 42nd Amendment in 1976, Article 51AH was added under the fundamental duties that states, it shall be the duty of every citizen of India to develop scientific temper, humanism, and the spirit of inquiry and reform. So these are the things which are, inculcated in our constitution. But how many of us are doing it? At least in the medical colleges. Chodo, if you give away, don't ask the layman to do that. But how many of the medical faculties are doing it? How many of the medical students are doing it? Even we are not able to do it. How can we ask the other people to do it? So these are the things: lack of scientific temper. We have very good constitution. Well, I have already told that we have a very good constitution, but we are not able to implement in the ground at the grassroots levels. That is a problem we are facing. We are, whatever is there in the paper, we are trying for. If we are able to, put in ground at least 50 to 60, 70%, we are a better nation. We are a great nation. But having said that, we need to improve, and we need to see these challenges and understand, and we have to change ourselves and also our society. Then only our country will improve. Way forward: overhauling of medical education, transparency, inclusive education, political wellness. So these are all important things. Having said that, giving a lecture is easy, but doing it on ground is rather very difficult, and we have to go, view our country beyond politics, beyond caste politics, beyond regional politics, beyond personal politics. We have to see our country as our country, our nation, India, and go forward with that. Then only we can be a developed nation. So overhauling of medical education, the private medical colleges especially should adhere to the National Medical Commission. They should not cheat, put in ghost faculties. There should be adequate faculty. The senior faculty should do their job. They should not exploit the junior faculties. There should be transparency. Students should be given adequate facilities. In terms of medical education, the education should be inclusive. The regional disparity should be removed. There should be education. The quality of education should be almost similar in the rural as well as urban areas. And the political willingness is also very important to solve lot of issues in our society. So these are the things we dream for our country. Yes, our country, it's our dream. Let us take it forward. So if you like my video, please like it. Please share this video to maximum number of people. Please also subscribe. I will put in more videos. These are only introductory videos. I will put in more videos based on NEET PG questions, FMG, or medical for MBBS graduates. Everything we will try to cover in the coming sessions. Please like, subscribe, and also share and comment your doubts. And I have put in my number in the comments and the description. Please, if you have any doubts, please ask via WhatsApp, or put in the comments down in the video. I will get in touch with you, or you can get in touch with me. Thank you for your time. Thank you for watching this video. Thank you.